I'm Chad Zekiel with Help on Demand. Thanks for joining us again for another edition of Help on Demand Live. As usual, I have my partner in crime, John Newmeyer, here with Help on Demand. Today, we are excited to have with us Jim Smallwood. Jim is president of employee benefits at Moody Insurance. He works with companies both large and small, has a fantastic perspective of the healthcare industry. Jim is also, in his spare time and part-time, he is a state senator here in Colorado and is a ranking member of the healthcare committee. So Jim, so good to have you with us today.
Thank you for having me.
We're going to talk about healthcare and technology today. You know, there's a lot going on there, and we'll cover a lot of ground. We're going to spend some time on the provider side of healthcare and technology. We'll also spend time maybe on the carrier side, where we touch on how technology has helped insurance companies provide better information and decision-making for both, physicians, hospitals, and also their patients and customers. And then lastly, we may dive into some policy a little bit too, since Jim has a part-time role doing that as well. So Jim, thanks for being here. Appreciate your time today. Why don't we jump in? Tell us a little bit about yourself, and we can cover some ground there.
Yeah. Happy to be here. Thanks for the invitation.
My pleasure.
Good to join you all. So, as you mentioned, I'm the president of employee benefits at Moody Insurance. It's really the only job I've had as an adult. So almost 30 years of doing the exact same thing most days, which is helping small to medium-sized businesses, municipalities navigate the world of employee benefits. So literally done that since 1993, and feels like a little bit longer. And as you mentioned, for the last 5 years, the part-time deal here in Colorado is I'm a state senator representing District 4 down in Douglas County, fantastic district, really focusing on the healthcare side of things. So I was the chair of our state Senate Health and Human Services Committee, and now I'm the ranking member in the minority party here in the state of Colorado. But it definitely gives a new perspective to the world of employee benefits. Like you mentioned, everything on the technological side, seeing the other side of this, sort of the governmental side of it, whereas an employee benefits consultant kind of dealing with it from the consumer's perspective. Yeah. So I think it rounds things out.
Yeah, so I know you do a lot of work with businesses and the public. So you have a very interesting perspective and experience in the healthcare business. So I wanted to kind of start off, it's maybe a little bit different angle, but I want to start on the provider side. We just come through the pandemic for COVID. We're on the other side of it for the most part. But, technology played a role in that world. I think the provider side, say, call it Teledocs, that's a company, but technology meeting up with providers and providing access to people, that had momentum, but the pandemic, it just exploded. So can you talk about what your customers and people you work with, what they're seeing with that and how they're using it?
Yeah, and you're right. It was a monumental shift, I think, from the decades-long practice of always walking into a doctor's office. That's kind of where you got your care, whether it was a physician's office, an urgent care facility, the ER, worst case scenario. That's kind of how Americans receive their healthcare by and large. And I've seen a tremendous shift. A little bit was happening before the pandemic, but the pandemic really triggered it to where now it feels like, to a large extent, patients are starting at their computers. Like, I don't feel well. I know something's going on. Where should I go for healthcare? Instead of picking up the phone and say, okay, well, now I'm going to hop onto the computer or hop onto my phone, look at an app that really guides me through that continuum of care. Like, should I go to my doctor's office? Should I have a van come to me? Not an ambulance, but an actual van that can give me urgent care or maybe non-emergency care, or hey, look, I'm being sent directly to the ER. This is something that's important. I need to go there. So, sort of that guidance that's coming from technology, or even maybe AI. I don't know necessarily everything that's going on behind the scenes in those apps, but it feels to us, and how we're educating employees is very often start on an app.
Right. What do you think? So you're working with the employers and the employees. Any changes in concerns of the employer? I know that a lot of times you're using employee benefits as a value add, right, to retain your employees or to recruit new employees. Is there any new challenges or opportunities for employers or whatever is on the benefits side?
Well, I think the job market has driven a lot of that, right? Where it used to be that employee benefits, particularly health insurance, were deemed to be sort of a perk, especially in the small businesses that weren't required to offer coverages. And now it almost seems like table stakes. Like you can't get in the game as an employer anymore unless you offer big company benefits, meaning the pricing needs to be there, the benefits themselves need to be there, and it expands, I think, far and wide from health insurance, dental insurance, retirement plans, transit programs, getting people to and from work. So I don't know that answers your question directly, but it's the biggest shift I've seen with the economy and the job market the way that it is you almost have to offer this stuff anymore. It's not an option.
Well,
especially with the
some
labor.
of them, whereas you can go as far as having pet insurance as an option,
Right.
identity theft products and stuff added on. So it gets to be quite a laundry list of stuff.
So I wanted to go back to the provider piece where, we talked about different avenues where providers and technology have met and gotten closer to the consumer, more access. So one is you're sitting at your computer, instead of using, say, Facebook and asking everybody what's wrong with me, you can go on your screen, pull it up. You would get a doctor on demand there. So that's one avenue. How do you see people using that? What's been the experience you've seen, Jim?
Well, it went from being a novelty. Like it wasn't that long ago when we were explaining to people that you actually can talk to other human beings on your telephone, period. When FaceTime was feeling new, when Skype was feeling new to be able to do that on a desktop computer. And it's become so commonplace anymore, especially for, I think, the younger generation, that it was a natural progression into, okay, you do this with the grandparents are doing this with you, you're doing this with your friends, and guess what? It is really the way you can get really fast, high quality healthcare. Not for everything, right? But I remember clearly, it was only 2 years ago, maybe 3 years ago, where I had an eye infection of some kind, and I used one of these programs for the first time, and I'm in the parking lot of a golf course with a camera, with my phone held up to my eye,
Close to your eye.
and there's an actual MD on the other side that said, yes, Mr. Smallwood, it looks like you have infective conjunctivitis. I see that there's this pharmacy that you put into the system that's only a half mile down the road. I'll get your prescription there right away. Go ahead and get it done. I hit end. It was a $40, $50 copay, something like that. I had to take no time off from work. I didn't have to sit in a waiting room full of sick people. And I was able to get to the pharmacy right away. And I think for those types of things, getting those diagnoses done so quickly, so effectively. I mean, I can't even imagine for folks that are staying home with kids, folks that don't have a lot of flexibility around their job schedule. It has been transformational.
And I think there's a lot of things that come with that, right? So you end up you end up getting a place of service. You do that over the phone, very little cost involved other than obviously the setup, versus someone may have just jumped in a car. You may have driven to the emergency room, or other people do that. I think it helps cut down on those emergency visits, which really drive healthcare costs in a huge way. So, that's exciting to have, that cost savings into the system. The other one we talked about briefly was actually being able to bring the provider actually on site, right? There's dispatch services that do things like that, maybe an urgent care visit, or maybe a concierge doc that maybe comes out to your home or facility if you have a big office building. So anything you want to talk about there, Jim?
Well, I would say that an interesting intersection between the private sector and government is addressing the correct place to get care. whether it's a Medicaid system in a state or a health plan or a self-funded employer, who's really looking to, or an experience-rated employer who's looking to keep healthcare costs down. You hit the nail on the head. Keeping people out of unnecessary ER visits is critically important. I mean, not only because of the cost of that visit, but very often those are out-of-network charges leading to much, much higher rates, even than an emergency room visit. And then all of the associated out-of-network costs, higher cost to the patient, very often claims issues experienced by the
bankruptcy follows.
And so back to John's point about how this is better for employers, being able to effectively communicate all of these strategies is something that an employer is now doing very often, or an HR department within an employer is doing for their employees. And it's more than just a health benefit, right? It's a lifestyle improvement that employers are able to pass along to employees. So, and again, this is all technologically driven. This stuff didn't exist when I started in the business, and we were still doing things via phone and fax, right? This was an impossibility.
Well, and I know, so, I spent some time at Connect for Health Colorado in the state, and, the policy there was no wrong door.
Yeah.
So that, I may want to buy or enroll or purchase a product or service differently than Chad or you. And so, I see that as technology as being that opportunity. I mean, you have the ability to go online and do it. You used to have somebody, to Chad's point, through a provider come and do enrollment meetings. Frankly, very kind of boring at the point, right? You took a lot of time away. So there has to be some of those kind of changes out there going on with technology for that.
Yeah, I do think that just 18 months has changed a lot of employers, particularly small employers, thoughts on how to communicate these benefits to employees.
Absolutely.
It went from, at least in a practice like ours, it was probably 80-90% those in-person open enrollment meetings that you're talking about. Some people can make it, some people can't.
Exactly.
Some people it's a huge distraction, some people it's not. Very rarely are there spouses there, who in a lot of cases are the ones driving the healthcare decisions for the families. And the pandemic really forced virtually all of us to do all of these via recorded videos that people watch at their home, at their leisure. They pause it, they watch a piece, they bring their spouse in to listen to another piece, or their adult children. So that communication is one of those things that I think is one of very, very few silver linings you can find in the pandemic.
Yeah, so I have a follow-up to that. So how is it more effective that way? Because we just talked a little bit about that. So it used to be maybe someone sitting there, their spouse isn't, they don't ask the right questions, they're not engaged, they're not interested, but those things come back to be an issue later. So have you seen the overall effectiveness of education improve?
Without question. And some of it's probably also the quality of video that's available to folks anymore. If you consider the setup that we're using right here, for example, this was something that was only available in very expensive studio time that you had to rent, and to take something now, where you're shooting videos and having it virtually instantaneously available to the employer is a pretty cool technological feature. And 9 out of 10 employers that we work with, after having gone through 2020, have told us we're never going back to traditional open enrollment. I mean, there's still a value in that one-on-one consultation, but the whole get the whole staff off of the floor, 200 people off the floor in a giant conference room listening to open enrollment meetings, by and large, is yesterday's plan.
And you have to, a lot of times, arm wrestle a large employer to do something like that, right? They're looking at it from a cost standpoint, right? So it's 200 employees times their hourly wage is you better be good. the meeting better be good, right? So that's great. I think some of the things that we do at Help on Demand kind of fall into that category of education and technology, right? Someone calls in, whether it be to an insurance carrier, or exchange, or some other industry. We are on the line with them immediately and provide that education. So,
well, nobody wants to wait anymore, right? Amazon's changed a lot of that. I want to order it now and I want to play with it later today or tomorrow, right? And so Yeah, how do you? So I'm kind of going down the marketing road
Yeah.
for your business. How have you seen techniques or ways that you're now trying to drive business into your benefits organization? How do you? I mean, has technology made a huge difference in that? Are you still relying on referrals into companies? I guess I'd be interested about how you're kind of redoing that now. I mean, with COVID, frankly, people lost their job. It's like, oh my God, I need benefits. Where do I go? How did you change maybe the way you grew your business through all that?
Yeah, that's a great question, John. And it's, I think it's different based on who you're talking to in the industry. I mean, there are so many of us that have been doing it for decades, and people, by and large, are still calling us. You know, you've got a reputation in a marketplace or within an industry or as an organization, so people are still calling. But when I see newer people in the industry, it's kind of twofold. They're using technology to reach out to prospective clients and get their name out there. So they're still using social media platforms. They're still using digital outreach, and people communicate with me like that. But I think what's most interesting in that sphere is how technological packages have become an integral part of what employee benefit consultants bring to the table. Like, how good are your either proprietary portals or portal relationships, so the tools that you're giving the employer for their employees to use. How well does your staff work with those programs? How well do they know them? How quickly and effectively can they implement them? So it used to be, you know, we talked about, this is the kind of insurance program you're going to have. This is the kind of retirement program. This is the kind of reimbursement programs you're going to have. So these kind of more products and consulting services. And now that's shifted to where now technology and technological packages, whether it's open enrollment, whether it's communication, whether it's analytics.
Yeah, I was going to say,
these are all part of it anymore.
Yeah.
So what type of analytics and tools or people are you bringing to the market that helps employers make decisions?
Well, it's another one of those table stakes kind of things, right? It used to be that only the largest global brokerages, consulting firms had these high-end analytics packages where employers could look at data, see the utilization, not per person necessarily, but in an aggregated way. This is the way that our employees are using the healthcare. This is where they're misusing it. This is where they're abusing it, either on purpose or accidentally.
Right.
These are the areas of opportunities where, as an employer, we can go to our staff and say, look, people are using the ER wrong. We need to do better education. Or more granularly, if that's a word, here's our population with diabetes, and this is what percentage of them over time are compliant with seeing their physician, getting their eyes checked, getting their blood work, and getting their insulin if they need it. I mean, those kind of packages were unobtainable for small and medium-sized brokerages not very long ago. And again, with the number of small employers that are now moving into these self-funded or ERISA plans where that kind of data is readily available, being able to bring those things, not like it's necessarily going to bring down costs instantly for an employer. I don't think that's realistic, but I do think there's a way to target educational opportunities that really make employees healthier, number one, and have them save a bunch of money, number two.
Yeah, I agree. It's to your point around what is now accessible to get access to that kind of data. I remember I started in healthcare in the it was a while ago in the early 90s, and that we were really on the forefront of delivering that information to some very, very big manufacturers in the Midwest, and we would drill down and provided fantastic data for decision making, and we worked with the local communities. It was very pioneering. It was a lot of fun, and to have that now for someone at a company of 150 or 500 employees
or less,
or less, certainly is fantastic, because it does make a difference. You're spending a lot of money for these benefits, and being able to create wellness programs, maybe create clarity for your employees around. If there's one hospital on this side of town that everyone or some people use, or a hospital on the other side of town, there are quality differences that are important as well.
For sure.
So it's great to hear that people are getting better access to that information.
And I didn't even mention that, but that's also another critical piece. Can you imagine 25 years ago, if you needed heart surgery, the amount of research that it would take to say, okay, who does heart surgeries?
Right. Yeah.
Who does this specific type of heart surgery? Who does it most often with the best outcomes, right? Not readmittance rates or mortality or anything along those lines. So who's the best at it? Oh, and by the way, who's also the most affordable at it?
Yeah.
I mean, that would have been a months-long or years-long project not that many decades ago. And today it's opening up your app, literally picking from a drop-down, putting it in there, and talk about ways of being able to benefit a patient that wasn't a reality not that long ago.
Well, and you know, that's the things we're getting asked to do with technology as an organization. I mean, it's, there were several news stories, at least here in Colorado, not too long ago, about people going to the wrong place. They go to an ER when they needed an urgent care, and the cost difference is dramatic, right? So now they get a bill for $45,000, where if they went to an urgent care, it's $1,000.
Right.
And so examples, what we're being asked in some cases is how to connect the patient with the physician quicker, and to get to the right one, who's closest to me, right? Maybe it's a star rating of who's the better oncologist, right, in my zip code.
Right.
We, a while back, were working with a customer in a nonprofit of saying, okay, well, my son became an opioid addict. We just found out about that. Oh my gosh, where do I go? So we're being asked, could you load in these treatment facilities in your system? And if it's 2:00 in the morning and I find this out and I'm freaking out, frankly, I could go into your system and find somebody that's open this very second, or a counselor to talk to. Right. And so I think that's where it's going to. And that's more effective care. I think it helps reduce some of the costs. You might speak to a little too. I know we were talking early on for the show about how to control costs. I mean, I can go to one hospital, Chad, and get a CT scan and it's $5,000. And I go to, could be across the street to another hospital and it's $2,000.
Or an outpatient facility that just does imaging, right?
Exactly.
So if you stay out of the hospital, that oftentimes cuts it into a third.
So are you, you're involved obviously with the state. What kind of things are you feeling those kind of things as well? I guess I'd be interested from that perspective, maybe your thoughts on some of that.
Yeah, I mean, in the governmental space, and certainly in the political arena, everything's more complicated because candidly, a lot of things become political really quickly. You've got an administration, depending on which state you're talking about, that's driven by one party or the other. Whichever party that is, there's another party that would really like to see them not in power any longer. So whether we're talking about the state government, federal government, in some cases even down to the county and city levels, everything that one does immediately gets put under the microscope by another party to see, okay, what are they doing wrong and how can we capitalize on that? So unlike the private sector where your success is measured by profitability or market share acquisition, outcomes, that kind of thing. With government, it makes it so much more challenging to do, I think, the right thing, number one, because it's so much more dangerous to take any risks, right? Taking risk means that an entire party gets booted out of office. So all of these challenges, we see it in Colorado. We're pretty much a one-party state as of lately, but everything that the party in power does is going to be looked at a little more closely. So I think there are some innovation that can potentially be missed because of that. People aren't willing to take risks, or they do what's politically expedient. So, hey, this is
Right.
going to make for good headlines, so let's
Yeah.
do this. Whereas the three of us in the healthcare space would look at it and go, well, that's not going to fix anything.
Right.
Oh, don't worry about that. It's going to make for a great headline. And that's the biggest. I mean, we see it here in Colorado as a Democrat-controlled state, but there are, I'm sure, plenty of other states across the country that are Republican controlled that are facing the exact same problems.
Sure.
Yeah, I don't think it's unique to certainly us in Colorado. I know that controlling costs, we've been in the insurance world for a long time, right? And that's always the issue. It's why schedules are created, inside health plans for controlling costs and overspending or overcharging, for example.
Yeah.
Jim, thanks today for the opportunity, Chad. And, we had a lot of content today that we went through and a lot that we need to get to yet.
Yeah.
So I would love to have you back, and we have a time to continue on with the conversation.
Look forward to it.